I am Dr. Khader Hussain AK, Consultant Thoracic Surgical Oncologist, Proton Cancer Centre, Chennai. So, the impact of COVID-19 on lung cancer, especially during this COVID era, has made a big impact on those patients who were detected with early lung cancers. Because what happens, the lessons that we learn from COVID is certain subset of patients who were harboring an early lung cancer, which cannot be detected by symptomatically to the clinicians, were detected by this COVID symptoms. Because patient had a COVID symptoms, they had gone to the doctor and they have done a CT scan where we picked up the early lung nodule in those patients who are affected with the early lung cancers. So, this COVID has taught a big lesson to us that the early lung cancers can be detected quite easily, and those lung cancers, if detected early, can be cured completely with one modality of treatment, maybe an extra modality of treatment including chemotherapy. So, this COVID has really taught us not a small lesson, it is a big lesson on the impact of lung cancer. The lung cancer burden in India is quite huge high. It is one of the most commonest cancers in both men and women in India. Among India, it is quite common in Northeast India, and the burden is almost 10 to 13 patients out of every 1 lakh gets lung cancer in India. So, it is a huge burden and it should be targeted specifically by screening high risk peoples who are at risk of getting lung cancer, especially those people who are smokers, who are exposed to the pollution, who are industrial workers and who have a family history of cancers. They all should be thought, screened regularly at regular intervals so that the lung cancer can be detected early and can be cured. The latest advances in the diagnosis and treatment of lung cancer starts with a simple CT guided biopsy. For example, if the patient harbors a nodule in the lung which is at the outer part of the lung, we try to do by a simple CT scan and guided biopsy. It will give us the diagnosis within 3 to 4 days, and once the diagnosis is made, we stage the patient and give the treatment according to that. The other way of detecting lung cancer is quite easy by doing a simple endoscopy, which we pass it through the nose. Small tube which is 7 millimeter goes inside. Any nodule which is found within the windpipe or the bronchial tree, we take out the biopsy and we get the answer. These are the two ways that we can clinch the diagnosis, and of course by experience, even by imaging with a special cancer scan called PET CT scan, you can even diagnose it easily. Robotic surgery is an ultra minimally invasive thoracic surgery which is the latest generation. This has made a greatest impact on the lung cancer management. Why? Because generally all lung cancer patients, they think that the procedure is quite complicated, it is quite painful, there is much more bleeding, and the length of stay in the hospital is quite high. This robotic surgery has revolutionized the treatment of lung cancer in a way that the patient can stay only for 2 or 3 days in the hospital, 8 millimeter incision, not more than that. Bleeding is almost less than 50 ml of each surgery, no pain, early recovery. You can start your further treatment in a few days or in a few weeks, and you can start doing your routine work from the day of 7 to 10 days. So, because of this, the lung cancer management has made it quite easy because of this technology to this humanity, where we can give a least trauma to the patients. So, the new innovations in thoracic surgery started with a diagnostic dilemma where the physician sees a small nodule in the lung. How to approach this? In India, lot of inflammatory disease are quite prevalent, where most of the physicians think that it is a inflammatory disease like a tuberculosis or any fungal infection. We can't approach those patients like that. Those are the era where we were approaching only by history and imaging. Now is the era where we try to find out what is the nodule that is present in the lung. This is something called as the image guided VATS, image guided video assisted thoracic surgery. This was actually pioneered in Southeast Asia, for example in China. So, when I was there in China, in Shanghai for a year or more, the nodules which were, because the Chinese people, they get screened every year regularly for those people who have the risk factors for getting lung cancers. So, how do they approach it? Say they found some nodule which is measuring between 2 or 3 or 4 millimeter. So, what they or we do is now is in India, we take the patient to the CT scan room and put a needle inside the nodule which we are planning to take it off. Then get the patient to the operating room and take it only that nodule and send it to the pathology department during the time of surgery. And once we confirm it, it's a cancer, then we do the proper cancer management team, and once it is not a cancer, then we come out with the same thing. This is a very easy and simple procedure where there is no diagnostic dilemma at all, and it is a one stop both for diagnosis and treatment, and you find out what is the correct solution for this. So, for those patients where the physician thinks that the patient is not fit for lung surgery, so what we try to do is for those patients who are high risk for getting lung cancer surgery or who are unfit, we do not give them the anesthesia, something what we call as a non-intubated video assisted thoracoscopic surgery. So, we try to give some anesthetic agent through our peripheral venous line, so that the patient is getting sedated, but try to breathe on its own. The patient will like to breathe on its own. So, what we try to do is we try to do a surgery, the same surgery what we were doing regularly on the other thing, we try to do it on the lung when the patient is taking a breath. It is a very difficult one to do the surgery because you need an enormous amount of training and you need a correct patient to select this. The biggest advantage is even patient with having a lot of comorbid factors who are at high risk for getting lung cancer, this surgery will make them safe and attains the same outcome of the patient as what they were doing in a traditional minimally invasive thoracic surgery.